Good morning, and thank you everyone for joining us today for our Digital Champions Network online workshop for October. I'm just going to start just with a brief acknowledgement of country. That I'd like to acknowledge the traditional owners and custodians of the land that I'm presenting from. That's the Bindal and Walgarukuba people, as well as those of the respective lands of everyone in today's call. I acknowledge the continuing connection to land, sea, and community, and pay my respects to elders past, present, and emerging. And thank you for anyone new here today. That's all our presenters and as well to Sally there at Maruna Gardens. I hope you're there on the call here. In that the Digital Champions Network is just our way of joining people together across North Queensland who've received the new technology through partnership between Northern Queensland Primary Health Network and with Vision Flex, just to help optimise use of the telehealth cards and embrace other digital technologies in providing healthcare across Northern Queensland. So to that end today, I'd like to introduce everybody to Maclean Care and our panellists here today, led by their CEO, Sue Thompson, who'll be presenting on their IH Health service. And so I might just hand over to Sue to sort of provide further introduction and to take it away. Thank you.
Thanks, Kieran. Lovely to meet everybody. So I'm assuming Mary and Sally are based in a residential aged care facility, and I see Maria. Is Maria residential aged care as well, or PHN?
Maria is part of our PHN team.
Okay, great.
So we've got Sally from Maruna Gardens in Bowen and Mary from Regis Aged Care in Ayr.
Great. So we just thought today we'd just start with a very, very brief introduction to IH Health, and then I'll swing to Sarah, Stuart and Paul, who will run the actual demonstration for you. Sarah is our Director of Clinical Governance, Quality and Risk. Stuart is our IT specialist, and Paul is our Director of Finance. So between the two of them, they'll run this particular demonstration for you. So just to give you a brief background on IH Health, we've been on this journey for the last 4 years, knowing that servicing older people in rural and remote geographical locations is very, very problematic, specifically because we are unable to access the workforce that our more urban counterparts are able to access. And it's not only access to the workforce, it's also access to specialist clinicians and allied health practitioners. So about 4 years ago, we knew that there was going to be a significant issue for us as an organisation. And so we set about trying to work out what we could do to get ahead of that curve to make sure that we were able to be in a position to provide services to older people living in our communities, which are primarily located in rural and remote parts of New South Wales, Queensland, and also some services in the Northern Territory and South Australia at the moment. So we started the process with a discovery journey with Deakin University, because what we wanted to be able to do was to put virtual clinicians at the bedside. And so with the help of Deakin in a discovery phase that took around eight months, we found out that there was nothing really that existed that aligned with what our vision was. So then we just embarked on a journey to build a virtual service where we could use technology and align that with a very skilled and capable workforce. So currently we have developed a bespoke platform that is our platform, serviced and maintained by us as an organisation. So it's not a Microsoft product, it's our product. And we have built, a system where the service is completely device agnostic. So we can integrate with any kind of piece of technology, so long as that the design on the other end is suitable for that compatibility. We also have a strong clinical workforce now that is working, employed by us as an organisation, that all work virtually and mostly are based on the eastern seaboard from South Australia right up into Queensland. And they consist of nurse practitioner, registered nurses, which are available 24 hours a day, allied health specialists such as speech pathology, OT, dietitians and physios, and they're in the main available 7 days a week as well. So we have a significant, cohort of clinicians that are able to provide services now to older people living in those remoter rural spaces. And currently we are servicing First Nations communities in the Northern Territory, along with other organisations outside of our own organisation in some of those M6 geographical locations. And what we're actually seeing at the moment, as far as outcomes go, people are, staying with the organisations a lot in a way that is more beneficial to them in, say, for example, if we have any falls or the like, we're able to, in the main, prevent about 64% of avoidable hospital admissions. So those outcomes are quite significant when you are looking at not only cost, but the impacts on older people. So what I might do now is just swing to Sarah, Stuart and Paul, and they can literally then show you how IH Health actually works.
Thanks, Sue. So what we'll be demonstrating for you today is a simulated home and community care client experience with a client post a knee reconstruction who required OT and physio services into their home. So I'll just hand to Paul, who'll be able to share the screen with us today. So what you're able to see here is our purpose-built web-based platform. Staff are able to access the platform using single sign-on and simply pushing join consultation.
Sarah,
Thanks,
and I'll
Paul.
be your registered nurse today, just asking a few questions about your recent admission to hospital for your knee replacement. I can see that you're part of the STRC program since you're home for some assistance now that you've been discharged. So firstly, I just wanted to ask how long you're in hospital for and the approximate date of your surgery, and confirm that you are type 1 diabetic.
Yeah, I'm a type 1 diabetic. I was in hospital about 4 weeks ago, and I was in hospital for about 4 days.
Okay, no worries at all. Did anyone speak to you about doing some exercises once you were home, and just double checking if you're experiencing any pain since the surgery?
They gave me basic exercises to do, and pain is probably 5 to 6 out of 10.
Okay, no worries. Can you tell me what you hope to get out of these sessions with us, and if there's anything like a goal towards that we're working with?
Yeah, my goals are to get my mobility back and to be able to enjoy life again with my new knee.
That sounds wonderful. That's exactly why we're here to help. So our team of clinicians are going to assess and create a treatment plan to start improving your mobility again. Our physio and occupational therapists are going to assess your seating and mobility and make sure that you're using the best equipment to give you strength, and also look at some exercises as well. And then our dietitian, Philippa, is going to touch base with you and make sure that we're managing your diabetes as well. But first, I'm just going to get Vanessa to do your blood pressure, your temperature and your pulse for me, and that'll come through.
So what we're going to do is just slide the blood pressure cuff up Steve's arm there, making sure that the correct arrows are pointing up and pointing down, and secure it around his arm. Then just pushing the start-stop button. For his temperature, holding it about 15 centimetres away from his forehead. And lastly, with his heart rate, just making sure that the monitor screen is facing up, and this reading will send it across to us.
That's great. So I can see the temperature, pulse and the oxygen have all come through. I'll just wait for the blood pressure now. Okay. Okay, wonderful. Well, I've got all of that information through here for me. So now I'll hand over to our physio.
So as you've just seen, IH Health uses a series of fully integrated IoT devices that have been TGA approved that allow for the seamless transition of clinical data directly into the system. So the page that you saw pop up in relation to the vital signs monitoring is what the clinician sees. And the data that was undertaken at the home with Steve directly integrates into that observation chart and is then graphed and is recorded. And additionally, the Clinical Excellence Commission framework for between the flags monitoring of vital signs anomalies is built into the system to allow for a stop and watch and easy recognition of a deteriorating patient, client, consumer, older person within the system that alerts both the clinicians, the team in IH Health, and the service staff. Also, what's really important is prior to the introduction of IH Health with any service provider, the on-the-ground teams are taken through a series of competency-based assessments to use both the system and any of the plugins or the IoT devices that are used to support clinical decision-making with the use of the platform. What's really important about the devices that are chosen to be used with the IH Health clinicians is that it eliminates the need for any care workers or healthcare assistant staff to be interpreting clinical data or providing any type of clinical assessment back to the clinicians. The clinicians are able to use the technology to undertake clinical assessment just as they would at the bedside or at the client's home. Thanks, Paul.
Hi, Steve. I'm Abby from Physio. How are you?
Good.
That's good. My job today, Steve, is to have a look at how you've been going with your mobility and see how your knee's progressing after your surgery. And what we're going to do is come up with an exercise plan to make sure you're rebuilding your strength and flexibility as much as possible. I heard you say before your pain was about a 6 out of 10. So what I might do is get you to show me how much you can straighten and bend your knee. So kicking that foot up into the air as much as you can. Beautiful. Hands down. What about trying to kick the knee straight? So kicking the foot into the air, trying to straighten the knee as much as you can. Well done. Okay, and you can relax. Perfect. Good. Okay, thank you. Next, we might have a look at you standing up and walking about 5 metres forward and then coming back to the chair and sitting down. That's it. Perfect. Okay, stop there and you can turn around and come back to the chair. Thank you. Beautiful. So, Steve, from what I've seen today, you need and would benefit from a targeted exercise program to help work towards those goals of yours and really make sure we're building strength and flexibility back into your knee. We could practice one exercise together. Could I get you just 3 times to cross your arms over your chest and stand up and sit down? So standing up, really making sure we're putting weight through both legs when we're doing that, and then sitting down and sitting down. Well done. 2 more times if you can for me. Beautiful. Well done. And 1 more time. Lovely. After doing that, what would you say your pain score is now? Has it changed from 6 or is it okay?
No, it's about the same.
About the same. Perfect.
It's just when you initially push off, it's a little bit more pain right then and there when you push.
Okay.
But then it evens out a little bit. Yeah.
Okay, good to know. So what I'll do is I'll put together a exercise program for you that will come in like a digital form. So there's little videos and pictures on there for you to follow along. Vanessa can print that out for you, and there's also an exercise journal in there that can help keep you really consistent with your exercises. And I'll see you again in a few weeks to progress those all. Okay?
Yeah.
Perfect. No worries. So now I'll hand over to Kat from Occupational Therapy. Thank you.
Okay, thank you.
Hi, Steve. My name's Katarina and I'll be your occupational therapist for today. So my role is to understand how you structure your day-to-day and also carry out simple daily tasks. So how do you feel that you're managing getting on and off the toilet at the moment?
Getting on the toilet isn't too bad because you just drop. Getting off the toilet is a problem. It's quite a hard push to get off the toilet.
And how do you feel you're managing day-to-day activities such as having a shower or getting dressed?
Yeah, having a shower is not too bad, but I get a bit tired by the end of the shower. I'm getting a bit tired and I want to have to sit down or something.
And how are you managing getting on and off the bed? Are you able to show me?
Okay. Can you have a little lie down?
Yeah. Oh, different.
Thanks. And when you're ready, Stephen, if you can show me how you get off the bed, please.
Stand up.
Yeah. Great, thank you.
Here.
You can sit back down in the chair. All right, you did that quite well. How do you feel getting on and off the bed?
Not too bad. It just my leg gets a bit tired and it won't do what you want it to do. So you got to kind of move it yourself, but you can't make the end work. You know what I mean?
No, you did a great job. Now, look, from my assessment, I'll be recommending a chair or a stool for you to sit on after having a shower to dry so that you can help manage your fatigue after a shower. I'll also be recommending a raised toilet seat to raise the height of the toilet to assist with you getting on and off the toilet. And I'll also recommend a height adjustable footstool just to help manage with some of the swelling you've been experiencing in your legs.
That'd be good.
Great. So I'll enter all of this information in your treatment plan and I'll liaise with Vanessa just regarding the equipment I've recommended. I'll also then follow up with yourself and Vanessa once the equipment has been delivered, just to ensure that it's set up right and if there are any other issues. Does that sound okay?
It sounds really good. Yeah.
Great. All right. That's really all from me for today. So I'll now pass you on to our dietitian, Philippa.
Hi, Steve. Thank you for seeing me today. My name is Philippa and I'm the dietitian. I've been asked to speak to you about your diabetes and have a chat to you about how foods can impact your blood sugar levels. Have you seen a dietitian before or spoken to someone to work through this with you previously?
Oh, a long time ago I saw a dietitian, but I've fallen into some bad habits since then, I think.
Yeah, okay. Well, if you're happy, we'll have a bit of a chat through this. There are some common foods that may raise your blood sugar levels are carbohydrates. And some examples of these include things like bread, cereals, fruits, starchy vegetables, desserts, and baked goods.
All the good stuff.
Of course. We'll still keep some of those in for you. Because like lots of things, it's about balance. Sometimes if you don't eat enough carbohydrates or you eat too much, that can cause high or low blood sugar levels and maybe make you feel a little bit dizzy or a bit faint. So if this happens, it's always good to test your blood sugar levels and your blood pressure so we can understand a bit about what's going on. If you're happy, what I recommend is that we have a bit of a talk and we'll chat a bit more about ways that we can alter your diet slightly, including the foods that you most enjoy, to ensure you're eating the right amount of carbohydrates for your diabetes. So if you're happy, I'll put together a meal plan from our discussion and all of this will be available in your IAS Health profile that Vanessa can print off for you. And I'll check back in with you again in a couple of weeks to see how you're going.
Oh, excellent. Thank you so much.
All right, no worries. I'll pass you back now to our RN Sarah to finish up the consult.
Okay, thank you. Bye-bye.
We'll just walk through our treatment plan now, so we can access that at any time from our profile page here. We come into our episode of care and see that this is our open assessment for our dietary, physiotherapy and occupational therapy here. On the right-hand side, we're able to view our treatment plan. And as you can see here, we've got some quick access tabs. So clicking on dietary brings you straight through to that section. Our physiotherapy section here, Abby's mentioned the exercise program. So scrolling down here to our PhysiTrack program, just noting the username and Steve's birth year of 1950 here. Clicking on this, and for confidentiality, we just entered that information in here. And here are the recommendations from Abby. Continuing to scroll down or use the tabs, and you can see our occupational page as well. So noting that once the care coordinators have ordered the equipment according to Katarina and performed any of the actions, we can come in here and click off. It will time and date stamp once this has been completed. And lastly, EOC actions in the top right-hand corner. We're able to click on that and download the treatment plan. So this can be used for printing out copies for Steve himself, for family members, for your own copy, or we are able to save it down to your own system and upload it to the other providers or care management systems accordingly. We're able to see Steve's information here, and all of the information from the treatment plan that you saw in IH Health has now formed part of this downloadable treatment plan.
That is the end of the demonstration.
I think so. It might be best to see if anybody has any questions about the treatment plan component of the system, just because it is so comprehensive, and we could potentially keep it specific to what people would like to know. But I think what's most important is knowing that that treatment plan is accessed from the shared hub between IH Health to the provider. So just like any current care management programs that are currently being used, as the clinicians are undertaking the assessments and things with Steve, they're generating their assessment in their end of the portal, which is then pushing out the care-related instruction to the provider end of the portal. So it's all in one shared space that can then be monitored by both the approved provider and also by the IH Health clinician. So just to give you a bit of an in-practice example for how that works, in some of the services that IH Health is used in residential facilities, as say, for example, the afternoon shift registered nurse, what will happen is that the care staff at the service use the IoT devices that were demonstrated early in the recording to undertake all of the post-falls monitoring observations and so on. And then that is overseen by the IH Health clinicians within the hub, and they meet in that virtual space to share information back and forward around clinical instruction and clinical review of the older person. Just also important to note that the system, IH Health, is completely device agnostic. In the residential environment, we do tend to use the computers on wheels or the computers on carts as opposed to iPads. In the home and community care services space, we can use any type of device, including a mobile phone, although we don't recommend it because it's not overly user-friendly with the screen size. But just I think it's important for you to know that for the most part, we're using a bigger piece of hardware when we're operating in residential facilities.
Thankfully, Sarah, they've got lovely, nice big carts helpfully provided via VisionFX with a nice full-size computer monitor screen.
That's what we're using.
Yes, and expecting that we'll be using a bit of a hybrid model there between your standard kind of equipment sort of rollout and what's already been provided there. So being device agnostic would be incredibly helpful. Actually, I might just sort of call out to the VisionFlex guys there if you would expect there would be any kind of flags around some of the equipment that you guys use that might have considerations for use with the IH Health sort of portal or anything like that, or your cameras, your temperature scanners or everything like that, you feel like they might integrate smoothly?
Yeah, no, it looks like a really good platform, and I don't see any issue. I mean, they just access the software through a web portal or installed on the cart. It's just a PC. It's under the management of the home, so they can use it however they want. And the only thing that might be a little tricky is if the devices like the temperature scanner and blood pressure and pulse oximeter and things like that, if they want to use both the Pro EX software and that platform, they'll have two sets of peripherals. But I don't see it as being an issue. They can use the peripherals that you guys provide, and then they can enter the data manually or vice versa. It's not going to be a huge issue. The main thing that will be really advantageous is the cameras that they all have, which are these medical cameras that can do up close wound examination and intraoral and so forth. Those will be able to be used just as a webcam plugged into the computer, so you can switch between the camera, face-to-face camera, and the wound camera. So as long as they get a bit of practice doing that, and in particular, as long as the nurses and the allied health staff and so forth who are joining call are aware of what capabilities are possible. So if they can have a bit of a run through, like a dry run, then they can say, hey, let's use the wound camera. Hey, let's use this and that. And they'll have a better experience overall. But no, it looks really good. Yeah.
Incidentally, on that camera, I'm hearing a lot of positive feedback from many homes regarding the use of that to get up close in speech pathology examinations. Certainly, it comes equipped with a bracket to use a tongue depressor, get right up to assess for swallowing technique and that sort of thing. So I'm sensing that there's some possibility there in integrating into your assessments.
Yeah, fantastic.
Mary, Sally, or as well, I see Marin, you've joined us from the Good Shepherd home as well. From that demonstration there with the OT, the physio, and what we've seen so far, did you have any questions you wanted to ask of the guys about IH Health?
No, we're finding that the telehealth trolley here and there is really useful for doing any telehealth appointments, which we're finding more and more of. Because we're rural, we find that it's very difficult to get local people in to do assessments. So we're doing a lot more on the telehealth now than we did before. And I think as just going back to a conversation Hannah and I had with you, Kieran, we are trying to work out a way where we can get that camera to become more portable, so we can use it for wounds as well. So we're just looking at that as well.
Just on that, not wanting to derail the conversation, but there is a wireless bridge device, which is just in quality assurance testing now, which will allow you to plug any USB camera. So it could be the examination glasses, which are really handy for that first-person perspective, or the wound camera. And make it wireless, so you can travel around the whole room up to 10, 15 meters and still broadcast a signal in HD. It's pretty cool. We'll send through some information when that becomes available.
Thank you. That's excellent. Thank you.
I might actually raise something myself, certainly on wound care and on the specialty nursing that IH Health offers. I know there was a bit of a possible sort of integration, I believe, with Erans Medical's silhouette star devices. I know, look, I find those devices pretty cool. Maybe I could ask if you guys might speak to them, speak about those and how they might be integrated to wound care, and maybe your wound care offerings, which are definitely of interest to many of these more rural homes.
Sue, are you happy for me to take that one?
Yes, thanks, Sarah.
IH Health uses Silhouette as the plug-in for wound care. So if you look at both the clinicians' end user view of IH Health, they have access to the software, so to the Silhouette software. So all the clinician needs to do at the bedside is instruct the care worker that they're working with to line up the series of lasers across the wound and press the button. Because that it is integrated with IH Health, that immediately transfers to the clinician at the time of assessment. and the Silhouette software is then able to, the clinician is then able to use the Silhouette software to undertake a comprehensive wound care assessment at the time with the care worker and with the older person, just as they would at the bedside. The only part of a thorough wound care assessment that can't be done by the clinician with the use of that technology is obviously assessing for odour. We haven't found anything that will smell virtually for us yet, but I'm sure it will come. Then through the onboarding process, the staff undertake a series of basic wound care competencies and are then able to dress the wound within their scope of practice under the direct virtual supervision of the registered nurse who's working for them on that day. Together, they complete the wound care chart in Silhouette and provide the ongoing monitoring and the ongoing measurements and so on in relation to appropriate wound care. And again, that is also shared through the portal. So just as you saw the physiotherapy plan come up today in the portal, the wound care assessment documents are also provided through that portal. And Stuart's just going to share that for me. Thank you, Stuart. So this is the wound care assessment that's undertaken in Silhouette, and with each dressing change and so on, this assessment is updated just as it would be at the service level or at the bedside, and immediately available following the review in our shared platform.
Probably the other thing, Sarah, to mention is that from a staffing perspective, we have specialist wound care consultants that are seeing Cs in wound care as well. So.
And additionally too, I think it's really important to note as well that our CNCs and CNSs don't just work with care workers to undertake the dressings at the bedside either. They're able to also provide that expert advice, RN to RN. A lot of new grad support is happening through the platform. So, or when registered nurses less experienced with complex wounds require support, they will also work with the IH Health CNC using the exact same mechanisms of communication.
I'll open it up. Does anyone from the homes have any further questions about wound care, about what could be offered, or even about specialty nursing?
So currently within the IH Health team, we have a specialist older person's mental health registered nurse who is also a behaviour support specialist as well. We have palliative care clinical nurse consultants. We have a dietitian who's also a diabetic educator, and additionally, as Sue mentioned, a wound care CNC, and quite a few registered nurses with extensive aged care specialty background.
Really great information. Are there any other further questions from the homes, or just anything about the service at all that you can think of off the top of your heads that you're interested in if you were to consider engaging with IH Health, what you'd want to know about them? Cool, I think we've answered everybody pretty thoroughly then. Now, if they were to reach out to you guys to consider sort of signing up or taking advantage of some of the services, what would be the best way they'd go about making that first connection?
Hello, Sally from Marina Gardens. Now, I would be interested in learning more about your physiotherapist and OT services. So the best way would be to reach out by email first, so I can get the information, pass it on, because I don't have any clinical knowledge, to be able to pass it on to the clinical team to see if that's something that we would consider, because we're in Bowen, North Queensland, and finding physiotherapists and OT is very difficult.
So Kieran, do you have Vanessa's email address that you might be able to share with the group?
For sure I do. Yeah, I was absolutely deferring to you guys before I just decided to here's the personal email address of the CEO.
Yeah.
But as to who the most appropriate contact person was,
Yeah,
Sally,
as the
Sally, and to
first
anyone
point.
else who's interested, I will pass through the contact details for further information on those specific services and to discuss how they might be implemented in your home.
So what Vanessa will do, she'll look at each specific request and then deploy that to whoever is the best person to come back with details or information on that.
Fantastic, thank you. Sally, did you have any further questions with regards to physio, or does that open up anything for anybody else? Victoria. Just on mute.
Oh yeah, I'm mute. Thank you. Look, I know this is out to the digital champions, Kieran, but we do have. I know that we've got digital champions in all our RACHs, and we have RACH meetings. And I'm really interested to see if we could call on you again to. We have guest speakers coming up in the next month or so, but call again to talk to the RACHs, especially around, and we've got rural homes around as Sally's pointed out, the allied health. But I see you've got palliative care, which is one area that I'm working in at the moment, trying to sort out training in that area as well, but supporting people, especially our rural homes, a bit more. Is it okay, Kieran? And I know this is your little group, but I've got my other groups. If we can call on you again to do discussions with that group, and we also have a community care group in Mackay as well. So if that's at all possible.
What we might do is, of course, share the recording of this session broadly, and then we might discuss future opportunities sort of out of session, just, to promote to that network as well. We might do a consolidated one or something as a special session. We'll work it sort of out in the background, and then see if the friendly team from IH Health might be able to entertain us with that one then, for further spreading of the good word about this service.
Given that they're the managers as well. So, what do you think, Janine and Maria?
Most of them are the decision makers or influencers.
Yes, they are the decision makers. So, I'm really keen. I'd be keen to look at all of that for those groups. Yeah.
No worries. Well, we can handle that in the background. We won't hold our speakers up over that particular discussion today. Does anyone have any questions they just need to get answered about the service at all, or feeling like we covered that pretty comprehensively?
Just quickly, so we've got services with many care systems. So they can is the idea they can upload your care notes into their care system, or do you integrate to any of those care systems by any chance?
Paul or Stuart, I might just swing to you.
Yeah, I'm happy to answer that one. So the answer is yes to both. So we're currently working really closely. We have some integrations with some of the CMSs already in the effort to then eliminate double handling of information, and we're continuing to work with all the major CMSs to progress that integration, and some of those are done, some of those are almost done, but as shown in the demonstration, you can also download it into a PDF, which can then be straight uploaded into all CMSs as well. So if it happened to be a CMS that we don't have an integration with currently, that would be the initial path while we can finalise the integration.
Paul, could you maybe list some of the major ones that were implemented quite strongly with, just to list a few names that might just prompt people? Or
look, eCase is one that we're working with. AliaCare is another. We ourselves use Telstra Health. There's a bit more work to do because it has to be done individually, but we can make that work as well. So we're actively working with all the major CMS providers. Our being a provider ourselves, we're very conscious we want to eliminate double handling and administrative work as much as possible so that the time can be delivered on delivering care. So we'll continue to work towards those integrations.
And I suppose the follow-on is, how is it working on the provider or maybe the GP's end? Do you integrate into any practice software at all, or is that export PDF, import into their notes?
Yeah, currently it's export PDF and import. That's another avenue we're working on as well with the integration. There's a number of practice management softwares programs as well. So just working through that process, but our goal is, or our development pathway is very much an integrative interoperability program so that we can eliminate any need to download and upload. We just have to work through that as we go.
Really pleased to hear about the ongoing development. I look like I've got a question in the chat there, just that we'd like to know a little bit more about the business model potentially, as in the services bulk build, or if we can maybe speak a little bit to that, knowing that a lot of it would be bespoke to the homes, but just some general terms.
Yeah, I'm happy to talk to that as well. I think your point, it's bespoke to the provider. Every provider will have unique needs. We know that. We've got 6 homes, and each one of those homes has different needs and different demands from the service. So what we do is work really closely with each provider to understand what they need, how it works. We understand that it changes all the time as well when you change, when residents come and go. So what we'll do is work closely, understand that. We have a variety of models. It can be a complete subscription model where you pay a monthly fee and you get full access to the system. It can be a fee for consultation. It's completely flexible so that we can tailor it to the needs of each provider. So yeah, I think that's the easiest way to answer it. It's completely flexible and we can offer anything.
We appreciate the commentary on that. Obviously, the one in the back of everybody's minds is, what will this cost me? And some assurances that that it's very open to sort of what you sort of choose and agree to, that there are fee for individual services, or the more comprehensive package deal. It's going to be really important for some of our smaller rural homes versus the larger ones in the more metro centres. So very good to know that you guys have that flexibility to offer, and very appreciative of that. Any further commentary from the team maybe on that note, or?
Can I just add to what Paul's just mentioned there, and the other part that we do combine that with is work with the provider to put metrics around that, so that they actually have input into the KPIs that they want back out. So, which is a very important part when you're paying for a service, to make sure that you're getting what you asked for. So we can always work with providers to get those metrics as well.
Great, thank you for that. And so, all right, I might just say that this section with our Q&A, we might just wrap that, move on with some final points to our meeting, and just sort of close off with general discussion and everything amongst our digital champions. Of course, the panel is excused from having to partake in those sorts of things, and I might end the recording, given that it'll be a fairly cosy session with the absence of the panel. So did you have any closing words before we wrap that section up?
No, just thank you for the opportunity today to talk to providers about IH Health, and we'll welcome any other opportunity that becomes available to discuss further. So thanks for having us, everybody.
All right, very appreciative of your time.